Welcome to Medicaid funding for school-based services and administrative activities, presented by Indiana Family to Family. Indiana Family to Family is the parent-to-parent organization and family-to-family health information center for the state of Indiana. These centers are statewide, family-led organizations that assist families of children and youth with diverse health and mental health diagnoses and disabilities, and the professionals who serve them. We provide information, education, training, support, and outreach. The information in this video is current as of February 2026. As with any resources or information, it is important to verify the information provided to ensure it meets the same needs as your situation. Under federal law, public schools can participate in Medicaid claiming to obtain reimbursement for IEP required medical services and some administrative activities. This includes public school corporations, public charter schools, and public turnaround academies. There are two types of school-based Medicaid claiming. The first is for medical services that are IEP required to be provided by the school. This can include nursing, physical, occupational, or speech therapy, applied behavior analysis or ABA, and audiology services. Schools can also submit a claim for administrative activities that some staff perform. These activities could include providing information to students and families about Hoosier HealthWise, Medicaid, CHIP, and other healthcare benefits, referring a student to medical, dental, vision, or mental health diagnostic and treatment services, arranging translation services required for a family to access needed healthcare needs. While you may think that schools already receive special education funds under the Individuals with Disabilities Education Act to cover IEP required services, those funds don't always cover all of the school's costs. Therefore, the Social Security Act includes Medicaid claiming as another funding source for public schools to provide IEP required services to students. Schools are required to obtain parental or guardian consent prior to billing Medicaid. Additionally, schools must provide annual written notice to parents and guardians, which is often included in the Notice of Procedural Safeguards. Consent for your child's school to bill Medicaid is entirely voluntary and doesn't affect the services your child receives. Families often have concerns about how their child's school billing Medicaid may affect their benefits or other non-school related services that their child is receiving. The free appropriate public education that must be provided under IDEA, Individuals with Disabilities in Education Act, prevents benefits from being affected as IEP required services must be provided at no cost to the parent or child. Also, children can still receive medically necessary services like those being provided in the public school setting from an outside provider. It is also the parent's choice if they would like to provide a copy of their child's IEP to the managed care plan, but it's not required. If a family has an issue with this, they can contact the Indiana Department of Education Medicaid specialist. Finally, schools are required to provide all IEP services to a child even if the parent does not consent to Medicaid billing. If you'd like more information on this topic, including the Medicaid Billing Toolkit for health-related IEP services, you can visit the Indiana Department of Education's website about school Medicaid claiming, which is shown on your screen and also found in the caption of this video. Additional information on this topic as well as others can be found on the Indiana Family to Family website. For one-on-one support, you can complete the form found on our Connect page of our website, call 844-323-4636, or email info@inf2f.org.